Welcome to this explainer. Today, we're diving into a highly effective, evidence-based framework established by the Thai Health Literacy Promotion Association. We're going to explore how corporate well-being is completely shifting. It's no longer just a nice-to-have employee perk, it is a core, strategic tool that literally drives operational efficiency. Let's get right into it.
Section 1. The Health Literate Workplace. Let's start by pinning down exactly what we mean by organizational health from an academic perspective. This brings us to workplace health literacy, or WHL. So what is it? Basically, it's an environment where an organization systematically supports its people to access, understand, and critically apply health information. This is a massive paradigm shift, you guys. We're moving the heavy lifting of health from being just an isolated individual problem right over to a systematic organizational responsibility.
Think of it this way. We're moving away from merely reacting to illness on a personal level. Instead, we are proactively designing a culture of health. It's a structural, incredibly deliberate approach to managing your most valuable asset, your human capital.
Section 2. A strategic directing tool. So, how do we practically build this systemic design? Well, it all comes down to the assessment criteria. And here is the fundamental premise of the source material. The assessment criteria act as a directing tool for executives and core teams to drive their organization forward. I really want to emphasize this point. This framework, it is not just some passive HR checklist that gathers dust. It's an active, strategic instrument that management uses to drive tangible, real-world organizational change. When you actually use this directing tool, you foster continuous quality improvement, or CQI. By consistently applying these criteria, an organization elevates its employees' capabilities. We're talking about moving them from basic, box-ticking compliance all the way up to interactive and critical health literacy. This empowers them to make informed decisions that impact their broader lives. Section 3. 5 core organizational outcomes. Let's see how these qualitative ideas translate into cold, hard, measurable corporate success.
Rigorously implementing this framework sets off a brilliant chain reaction. First, you get an increase in health-literate individuals. That actively mitigates health problems and actually transforms underlying health determinants. Ultimately, this shifts the entire organizational culture. And here's the best part. It bridges the gap between human well-being and concrete business metrics, resulting in reduced costs and increased productivity. So, we're looking at a very clear dual benefit here. Investing in health determinants isn't just the right thing to do ethically, it directly reduces corporate overhead related to illness while simultaneously driving up operational efficiency and output. It's pretty simple. A healthier workforce is fundamentally a more productive workforce. Section 4. The Blueprint for Change. Okay, let's unpack the actual architectural framework you need to make this transformation happen. To ensure absolute academic rigor and trackable progress, the criteria are methodically broken down into a 5x16 structure. That means 5 overarching core assessment categories which contain 16 highly specific assessment issues. This gives leadership a super clear, quantitative roadmap. No guesswork involved. Furthermore, this framework isn't just pulled out of thin air. It's internationally anchored. It utilizes BRAC's well-established house model, specifically the 10 Attributes Framework for health-literate healthcare organizations. This ensures your evaluation is comprehensive and globally recognized across the entire enterprise. By taking this framework and evaluating those 16 specific issues, leaders can accurately pinpoint operational gaps. It completely changes the game. You're transforming potential weaknesses into strategic opportunities, perfectly aligning your corporate development with broader national health and productivity goals. The evidence is crystal clear here. Well-being is an absolute core driver of efficiency. As we wrap up this explainer, I strongly urge you to take a hard look at your own corporate culture and ask yourself this vital question. Is your organization simply reacting to sickness, or are you actively directing health? Thanks so much for joining me today.